Hello, Dr. Victor here, hitting you up again with a video related to fasting. And today we'll talk about fasting side effects, because there can be some mild or even severe side effects of fasting, especially if you don't do it properly. So let's begin! Fasting, if you do it properly and progressively, like I talked in the previous video about how to fast, is safe. Depending on your body weight, you can go pretty long without eating anything. For example, one of the longest fasts recorded in history was of Angus Berbery, which he fasted for about 382 days with no food. So over a year of no food. He lost about 300 pounds, and of course this fast was medically supervised. He was severely overweight, so he had the energy stores to keep him without no food for over a year. Another case was of Dennis Geller Goodwin, who supposedly lasted for 385 days on a hunger strike. Now, does this mean that I recommend you do over a year of fasting? Yes. No, of course not. But if you are doing it correctly, fasting is safe. So of course studies have been conducted related to fasting and to see the adverse effects. For example, when people tried time-restricted eating for a window of 6 hours, they had several adverse effects, including vomiting, headaches, increased thirst, and diarrhea. But in the same study, when participants chose to do a 10-hour window of time-restricted eating, they did not report any of these adverse effects. They also reduced the weight, blood pressure, and improved atherogenic lipids, so improving metabolic syndrome. So many people will experience hunger, irritability, and a reduced ability to concentrate during periods of food restriction. However, these initial side effects usually disappear within a month. Hey Victor, why are you standing up and why do you look so different? Well, it might be because the sound from the last video got cut off, so I have to do this video again, at least the last part of the video. So here we are. So now to see the adverse effects of fasting, let's look at an amazing study that was done on over 1,400 subjects that fasted from 4 days up until 21 days, so a prolonged fast. So right here we can see the most frequent symptoms of this fast. We can see one of the most frequent was sleep disturbance, fatigue, dry mouth, back pain, hunger. That's surprising. Why would someone feel hunger after 21 days of not eating? That's weird. Also other different types of symptoms. There are also some serious adverse effects, but only for about under 1% of the whole patients, like cardiac arrhythmia, hyponatremia, hospitalization. But overall they saw an increase in physical and emotional well-being and an absence of hunger feeling in 93% of the subjects. Also among around the 400 subjects with pre-existing health complaints, most of them reported an improvement. They concluded in the study that the fast led to enhancement of emotional and physical well-being and also improvements in relevant cardiovascular risk factors. So even though there were some symptoms throughout the fast, most of the people reported feeling better. Of course, most of the subjects lost weight. The more they fasted, the more weight they lost. As you saw, of course, there might be some side effects of fasting, especially prolonged fasting, but if you stick to some good strategies, and also if you watch my video that I just previously did on fasting, how to do it properly to limit adverse effects, you'll be okay. Some things to keep in mind with this study were that people did drink plenty of liquids in the study, about 3 liters of water every day, and they did eat something along the lines of 200-250 calories per day, which they ate a soup, they did drink some tea, so it was not a 0-calorie fast every day. So, thanks for watching, leave a like, subscribe if you enjoyed the content, and we'll see each other in the next video when we're gonna talk about who shouldn't fast. So, we'll see each other next time. Salut!